Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. The information is not to be interpreted as or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, or treatment.
Hello and welcome to this week's Dutch podcast. On this week's podcast, I have an expert I'm really excited about, one of our country's top experts on pelvic floor health for women. Now, this is a topic that really a lot of patients have. They came into my practice, asked about this, but it was kind of one of those doorknob conversations where just as they're about to leave, they've spent an hour, half an hour with you, your hand's on the door, and then they say, oh, wait, I just have this one more thing I want to talk about. And it's that thing that they were embarrassed to talk about, maybe urinary leakage or bowel trouble or pain with intercourse, or just feeling like you're not yourself recovering from birth. These are things we want to bring into the limelight because they're not things that should feel embarrassing and because there's a solution to the problem. So I'm really excited to talk about this. We're going to get into all the symptoms that might lead you to think that seeing a pelvic floor physical therapist could help you, and some of the preventive strategies that all women should think about before they're pregnant, after they have a baby, during perimenopause and menopause. And even we talk about with teenage girls when menstruating, that can be a trigger for some pelvic floor dysfunction. You're going to want to tune in. Really great recommendations that we covered today. And I'm really excited to welcome our fabulous guest. Let's get started. Since 2007, Dr. Sara Reardon has been caring for people's pelvic floors as a board-certified pelvic floor physical therapist. She's the founder and the chief vagina officer, I love that title, of the Vagina Whisperer, an online pelvic floor workout program for women of every age and stage. You can find her online as the Vagina Whisperer. Sara is the author of Floored, a woman's guide to pelvic health, floor health at every age and stage, which is coming out this June 2005. Congratulations on your book, and welcome to the Dutch Podcast.
Thanks for having me.
I'm so excited to talk about this topic. It's something that is still something women don't like to talk about. I'm really excited to have you here to kind of like normalize what this is, help spread the messaging of the positive impact it can have in women's lives, and really just learn more about it from your expertise. So I'm so glad you're here.
Yeah, this is great. And I think it's interesting because I talk about the pelvic floor all day. It's dinner table conversation for my family. It's, I speak with women all throughout the day in my clinic. And I think that women don't realize that they're even having pelvic floor issues or where to go to get help. So I really love chatting about this because my goal is to help normalize the conversations versus normalize the problems, which I think has been the narrative for so long.
Well, can you start by just describing, like, what is the pelvic floor? What does it do? Why is it important? How does it become dysfunctional?
Absolutely. So the pelvic floor is a basket of muscles at the base of your pelvis. So we think about the bony skeleton or, the skeleton bones we see on jammies or when we place our hand on our hips. That's bones. And at the base of that bony outlet is a basket of muscles that's like a hammock. So those muscles support your pelvic organs like your uterus, your bladder, your rectum, your ovaries. It also has the openings for the urethra, where urine exits, the vagina for vaginal intercourse, menstruation, or vaginal birth, and then the anal opening for bowel movements. So if you're experiencing anything from urinary leakage or frequent urination to constipation, hemorrhoids, or if you're pregnant, postpartum, menopausal, your pelvic floor is going to be affected because it is involved in all of those arenas. And that's why I think it's really important to kind of educate women about what does this muscle do so that if there's an issue, they know that pelvic floor therapy can be an option for them.
And what are some of the symptoms that women should know about that could lead them to think like maybe I should have my pelvic floor evaluated?
So, in my dream world, going to see a pelvic floor therapist is like going to see a dentist. We start when we get our periods or when we start becoming sexually active. And it's just a routine checkup, just like seeing a gynecologist as well. And so you kind of know what your normal is before you feel like you're just doing damage control when symptoms arise. But some of the more common symptoms women experience, hands down, the most common is urinary leakage. So this can be a little leak with a cough or sneeze, leakage with exercise or jumping, or even just rushing to the bathroom and not making it in time. Other symptoms are painful intercourse because the group of muscles has the opening to the vagina. If it feels like something's hitting a wall when you're trying to insert it into the vagina, or pain after intercourse, difficulty with orgasms as well because these muscles contract and relax during an orgasm. And then also bowel movement issues like constipation, straining with bowel movements, fecal leakage, staining in the underwear, hemorrhoids. Really, anything involved in those outlets is typically a pelvic floor muscle issue.
Yeah, it's so interesting because I think a lot of people don't really think about pelvic floor health for a lot of those issues. Like even dyspareunia, that's something
Right.
that, I was never taught to look at pelvic floor therapy for that, as a naturopathic doctor. So it's very
Yeah.
interesting, and it's great to bring awareness to it because we talk a lot about root cause on this podcast, and here you're talking about like a contributor probably for all of those conditions in most cases, even if it's not the sole contributor.
Right. And I think that that's one thing that we're really, medicine is so specialized, which I think has been wonderful, but I think it also silos what we're looking at.
Mm.
So if you're say, you're experiencing dyspareunia, which is painful sex, you can say, is it a tissue problem or from low estrogen or birth control or menopause? Is it a nerve issue that there could be pudendal nerve irritation or sharp shooting pain? Is it a muscle issue? Or is it an infection? So we're looking at all these things when really, even if there's another cause like infection or a nerve problem, the muscles are likely involved and have to be additionally addressed, which is, 1 in 4 women experience pain, sex or pelvic pain at some point in their lifetime, and that's likely underreported. So this is happening, but we're just not talking about it or not knowing where to get help.
I can imagine a lot of the conversations you have with your clients where when they like finally have the courage to book an appointment and they come in to see you, it's like the exhale, that I can just envision the energy in the room, which is like, okay, like I'm ready for help. Let's get this going. Like someone I can talk about with this. It's not going to think it's weird.
Absolutely. And I think it's why I really love being so vocal about it because, I've been in this field for over 18 years when pelvic floor therapy was just nobody even knew what it was. And now it's really becoming much more talked about thanks to social media and different outlets like your podcast. But, women are suffering for so long and it takes a lot of courage to talk about this. One, they don't know where to go. And then once they do come in, it feels weird. It feels shameful. It feels embarrassing. And so I love that exhale when the shoulders drop, when their kind of face softens and they really feel like, okay, I'm in the right place and I'm going to actually get help for this, which has been affecting them for so long.
Right. Yeah. It's a struggle. It's definitely a struggle for a lot of women. Now, what's the number one reason why people come in to see you or buy your programs?
I think initially a lot of it started with pregnancy and postpartum. We know that pregnancy is one of the biggest risk factors for having a pelvic floor problem. It causes your muscles to stretch out and weaken. You either have a vaginal birth or a cesarean birth, both which affect the pelvic floor. I think a misnomer is that if you have a C-section, your vagina is spared, which is not the case. Your pelvic floor changes itself during pregnancy. And then when you are postpartum, you are healing. Your pelvic floor muscles are functioning at 50% at your 6-week mark, which is when most of us are
Mm.
clear to go back to sex and exercise, but your body has not recovered. And so we see a lot of women during those 2 life stages with things like leakage, back pain, abdominal separation, pelvic organ prolapse when their organs aren't as supported by that hammock of muscles. And they're like, wait, is this my new normal? Is this like the price I have to pay for being a mom? And it's not. We just haven't given women the resources to rehabilitate and strengthen. And then now I see many more women coming in during perimenopause and menopause when those hormonal stores are changing, their estrogen's declining, and they have more weakness and leakage and things like that.
That's great to understand, and I'm so glad that you're making the point about the like pregnancy. Like that is a dramatic change to the pelvic floor, and in this country, we don't even really educate moms, like pregnant moms, on the availability of this. And I've had 4 vaginal births, 4 pregnancies. My 4th child was over 10 pounds,
Wow.
and it's funny because as I was prepping for that, like after I had my 3rd, I knew I didn't feel the same, and with my 4th, I like wanted a pelvic floor PT on the clock, like ready to come postpartum. And, she had recommended we start at 6 weeks, but she did come earlier and we just focused on breathing. And it was such an interesting thing because even without straining, Like I didn't really ever have awareness of like transverse abdominis muscles and like even the
Right.
basics of how to hold your core. I mean, I got so much value out of it. And I did like a full 12 weeks in person with her and felt
Love
like
that.
so recovered when we started. And I just wish that I mean, it was a game changer for me in my recovery. It really was. And I just wish that more moms knew about this to really get connected. It should be part of OB care. Like it should be just standard. I mean, I really wish it was that it was just covered. I had to pay cash for it, right? It wasn't a covered thing because I wasn't, diagnosed with anything at that point. But it should just be a piece of recovery, just like a lactation consultant.
Right. And, when I started my Instagram account, The Vagina Whisperer, it was when I was pregnant with my second son. And all of my girlfriends were emailing me, like, what do I do for this? Or how do I do perineal massage? Or what's the best belly support? And I'm thinking, everybody should know about this. Like, why am I just the lucky one who chose this path, who can kind of prepare for birth and then recover postpartum? And I had really great births. And I think a lot of it was due to kind of this just knowledge and preparation that I had. And I want everyone to have access to that. And so I created my online program. It started with pregnancy and postpartum. Now it's, prolapse and menopause and post-surgical recovery. But it was really like so many women go through this and we know it's going to change their pelvic floor, but they're not getting any help for it. And so again, afterwards, you almost feel like it's the cost of motherhood, which I just don't think it's fair. And also, we are getting really consistent OB care during pregnancy, but postpartum, it's like practically nothing.
It's nothing. Yeah.
It's nothing. 40% of moms don't go to their postpartum OB visits. And I'm like, so they're getting nothing. And yet that's when we really need the care and recovery. So
and support. I mean, there's so much else that should be provided at that
I
time.
know,
Right?
so many
Help
things.
women through that transition. Yeah.
So many things.
How did you become so interested in this specific specialty within physical therapy? How did you become the Vagina Whisperer? Like, you got to tell us that story.
So, well, there's a couple different moments, but, I wrote about this in my book, Floored, which is coming out. And one of the biggest things was when I was in graduate school, I had a professor who was really a pioneer in the field. Back then it was called women's health. Now it's called pelvic health because everyone has a pelvic floor. And it was just a 2-week, lecture series about the pelvic floor. And I was thinking, oh my gosh, this is so fascinating. I didn't even know these muscles existed. And it helped me learn more about my body as a woman. It was like, oh, I'm thinking about how I'm peeing and I shouldn't push. And I'm thinking about how I'm running and I need a strong core and pelvic floor. And it just changed the way I started caring for my own body. And then I really loved just helping other women understand their bodies. I felt it was so important. So I started in this right after PT school 18 years ago. And when again, I was, I would get together with my college girlfriends every summer. And there was a summer I was sitting in the hot tub with a bunch of their moms, and their moms started asking me about their bladder problems and their vaginas. And all of my girlfriends were like, she's like the Vagina Whisperer. So they really coined the name. And when I started my Instagram, it was for my group of friends. And then, so I named it the Vagina Whisperer after their nickname for me. But the growth of the account, I mean, we're at like over 650,000 followers. I think it's really because women aren't getting this information and they're really hungry for it. And now they're demanding it from healthcare. So it's really a testament to how much women want and need this information.
Mm. Now, one of the things I want to kind of start to get into pelvic floor health a little bit more with you. So can you tell me a little bit about like how and why this dysfunction starts?
Yeah.
You mentioned birth as like a trauma trigger, but what about for women who haven't given birth?
Right. And that's another great thing to clarify, which I'm so glad you brought it up, is that often people think that pelvic floor issues only affect women when they are pregnant, postpartum, or menopausal, which are 3 risk factors for developing pelvic floor issues. However, so many women experience this and they've never given birth. So some of the early stages in life that we see problems arise are young female athletes have urinary leakage. So it's something along the lines of 40-something% of female athletes never given birth have leakage. And
That's shocking.
It is shocking. And it's from different activities like cheerleading, volleyball, gymnastics, kind of higher impact activities. But your pelvic floor is a muscle. So we may train the glutes and the abs and the hamstrings, but we're not training the pelvic floor. And I think that this is why it happens so consistently in young female athletes, because we're training their bodies, but not the pelvic floor, which is actually part of their core. And that's when leakage starts. Another time is when young women get their periods and they start becoming sexually active. And when they're trying to insert something in the vagina, like a tampon, or they're having a pelvic exam, or they're trying to, have vaginal intercourse, something can't insert into the vagina because there's muscle tension in the area. Some of that has to do with just our bodies. Like I get tension in my neck and shoulders and it gives me headaches and migraine, right? The same thing can happen in our pelvic floors. We just hold tension in that area. Other factors are there's just a lack of education. People don't even know where the vaginal opening is. And, if something is talked about as bad or shameful for so long, when we're just supposed to flip a switch and put something in our vaginas, we can't relax. And then there also can be trauma. It can be sexual trauma. It can be physical trauma. Those are also things that can contribute to pelvic floor muscle tension and dysfunction. So in those early stages, there's no education. We maybe get sex ed, we maybe get some period education, but there's no pelvic floor education. And there are different components that can also kind of increase the risk, like exercise or trauma.
Are there any like non-physical contributors like diet, alcohol, sleep, anything else that you notice, fiber content?
So, when it comes to peeing and pooping issues, childhood constipation is another one, which is a huge issue for kiddos. Processed foods, lack of activity, like dependence on laxatives or Miralax, that's another predisposing factor. We see people who have, bowel movement issues older often have a history of childhood constipation and they strain with bowel movements. And that's a risk factor for weakening the pelvic floor. Another one is bedwetting because they may be holding their bladders. They may develop urinary tract infections. Those are all kind of different traumas to the pelvic floor as well. So there are other things like that. But I honestly think one of the biggest ones is stress. And I talk about this because in order for our pelvic floor muscles to relax and to function well, our nervous system needs to be calm and quiet. But in the pace of world that we live in with screens and, performance expectations and anxiety and prolonged sitting and lack of activity and kind of crappy foods, like all of that just upregulates our nervous system, which causes tension. And tension can lead to inability to empty your bladder well, straining with bowel movements, nerve pain, pelvic muscle tension, poor posture. So, pelvic floor therapy, I always say, is a piece of the puzzle. It's not just going to be addressing the muscles. There's often all these other components we need to look at as well.
You mentioned like prolonged sitting too, and I bet that probably has a big contributor because we're meant to be a little bit more upright more hours of the day.
Right. And tailbone pain. I mean, if you sit for a long time, your muscles get tight and you get tailbone pain and your tailbone attaches to your pelvic floor. So that's another one that people don't think of. Oh, is this a pelvic floor issue? And it totally is.
Interesting. So, I think I want to kind of talk a little bit more in depth about a couple of the common complaints that lead people into pelvic floor therapy. I want to start with bladder issues. I do think you mentioned this before. A lot of people think, oh, this is just aging. This is just what happens after you have a baby. It's something that you just have to deal with as a mom, you'd mentioned, or, into perimenopause and menopause, that same thing. Like, oh, this is kind of a part of aging. Is that leakage like normal or is it just common but abnormal?
I always will go back to it. Leakage is common, but it is abnormal.
Okay.
No amount of leakage is normal. Normal function is to be able to hold urine during activities, and then when you get to the restroom to relax and have your bladder empty. What happens is that these little leaks start to pop up when we're, early with exercise, pregnancy, postpartum, perimenopausal, and then they become much more consistent. So we kind of normalize them during different stages. But then once we hit perimenopause and menopause, your estrogen levels tank, which is normal. That's normal because you're not ovulating anymore. But what happens when you have low estrogen is your vaginal tissues get thinner, they get drier, they get less supportive, there's less tone. We also lose muscle strength as we age, and your pelvic floor muscle loses strength as well. So we have to be really proactive in educating women to strengthen their pelvic floor, to kind of be on the front side of it and still waiting until, their 50s and 60s and they're leaking and they have UTIs and they have, they're in pads and diapers and then try to fix it. We really need to educate women much earlier. So 100% of women are going to go through menopause if they live long enough. And we know that that is going to cause changes to their pelvic floor. So we have to start helping women proactively, just like we do with osteoporosis or heart disease or breast cancer screenings. Like we know that these things increase in risk as we get older, just as pelvic floor problems do.
Yeah, and it's so impactful to women's lives as well. I mean, it's something that can be so shameful and embarrassing. Like it's a wonder we don't do things more proactively because it's not, they don't consider it as medical as something like osteoporosis probably, or because there's not a drug to treat it, maybe as well.
I
It
think
doesn't,
that that's a big part of it. There's not a lot
yeah.
of, there's no research trials from, medical device companies or pharmaceutical companies saying like, yay, pelvic floor therapy. This is exercise, but we emphasize strength training and exercise in older age, just like we need to do pelvic floor muscle training. I've been in this field for so long, and I gave a TED talk several years ago. And one of the stats I said, it was, 50% of women over the age of 65 leak urine. So 1 in 2 of us. And it's one of the number one risk factors for ending up in a nursing home is fecal incontinence, leakage of stool, and leakage of urine. And when I said that, my mom was like, oh, I need to kind of pay attention to this. And I'm like, Mom, I've been in this field for 15 years, but it was like, you hear something that you start thinking, oh, wow, this can really affect my life. It's not just buying pads at the grocery store. It's how I live, how I travel, how I socialize, how I, my skincare, everything. It really can start to overflow into different aspects. And that's where I'm like, I want us all to be able to have good sex and to exercise and to travel and to feel confident in our bodies at every stage versus we reach an age and we're like, oh, now I just kind of have to deal with this. And it does impact your quality of life.
Yeah, we don't want to be in that deal with it phase. I think we want to be proactive for prevention in this case as well. So I want to talk a little bit about bowel movements as well, because that's another big thing that can change. You mentioned childhood constipation, but a lot of adults suffer with that as well. So what can we do to have better bowel movements? Like, are there considerations for toilet use that we should be thinking about?
Right. So, the basics of getting enough fiber in your diet, getting enough hydration, movement is key as well. Activity can help with transit through of poop in your colon. But some of the other kind of more mechanical things are, I encourage everyone to use a squatty potty or a little stool underneath
I
their
was
feet.
wondering if you were going to mention the squatty potty today.
Always. Because putting your feet up on a stool puts you in more of a squatting position. And when I was writing my book, I went back and kind of studied the history of how did we end up on Western toilets? And it's really because once we moved toilets inside instead of outside, we made them chairs instead of squatting over the ground. But squatting is kind of the best physiological way to relax your pelvic floor to empty bowel movements. So using a squatty potty or a stool under your feet kind of helps that position.
Because it lifts your knees. It lifts your knees back up to more of a
squatting position, right?
Position.
And that relaxes your pelvic floor. And then also not holding your breath when you're trying to poop. So exhaling like you're right. So not straining, exhaling. I always feel like you're blowing out a bunch of birthday candles or like you're blowing out through a straw, and that helps relax your pelvic floor. And then I'm a big fan of bidets because it minimizes excessive wiping. It can help with hemorrhoids if you have them, just different things to kind of really baby the tissues in the area. The last thing I do is I take a lot of magnesium at nighttime. So I recommend magnesium citrate. It helps kind of bring water into your colon to make your poop softer, but it's one of the first things I recommend to people outside of taking like a laxative or something just to help soften their stool.
I always recommend that to the moms in my practice, to do as soon as they give birth or when they go into labor as well, because that's a time that can be pretty frightening to go to the bathroom after you've just had a baby. Pushing anything feels like you might rip in half. So that's another great time to do a little bit of extra magnesium to make sure that when things are in that healing phase.
Totally. And it's one of the more common reels or videos that people watch of mine on social media is how to take your first poop after giving birth. And they're like, nobody told me this. I'm like, every labor and delivery unit needs to have this in their bathrooms to put your feet on the stool, to support the vagina with your hand and a piece of toilet paper, or support your tummy with a pillow if you've had a C-section, to take the stool softeners or magnesium, to hydrate, to walk. I mean, all of those things really help just make that bowel movement less excruciating. It can be worse than birth if you don't know how to do it properly.
I'm thinking about men and women who've never given birth, who that just pops up on their feed. It's something that you never thought you would ever have to know about. That's pretty funny. Oh, how did this get tagged to me?
I know.
So, what are some habits that people can adopt to help encourage just a healthy pelvic floor in general?
So my biggest thing, one of the ones is like, one, if you're listening to this, I'm so glad you are, because I think knowing what some of the problems could be will help you get them addressed. The sooner the better. Some of the basic tips I tell people are, we just discussed one, how to poop properly, like feet on the squatty potty, exhaling as you're having bowel movement so that you're not straining. The second one is to not push when you pee. I think so often we are in a rush and we do what's called power peeing, which is like you sit down on the toilet and you try to push your stream out as fast as you can. And that can actually weaken your pelvic floor. We pee 6 to 8 times a day. And if you're pushing every single time, it's going to weaken your pelvic floor over time. And that can lead to leakage and prolapse. So when you pee, just sit. If, Try not to hover unless you're in like a really yucky bathroom, but sit down on the toilet and just take some deep breaths and lean forward. And your bladder's a muscle that will actually push the urine out for you so you don't have to push it. So that's another really important one. The last one is to exhale when you're exerting effort. And I say this because you'll often see people working out in the gym and they're holding their breath. When you hold your breath, it traps all of this air in your pelvic cavity and pushes down. And that is going to lead to weakness and prolapse and leakage over time. And even little things like when you're lifting your stroller into the car, when you're lifting a heavy bag of groceries, when you're pushing a piece of furniture, you have to exhale as you do that, because if you hold your breath, that breath is going to find the path of least resistance. And if you have a vagina, the vagina is the path of least resistance where there's weakness. So it will always go down. So just kind of those simple day-to-day tips. Like when I pick up my son, I'm like, okay, buddy, 1, 2, and I exhale as I lift him. When I'm lifting weights, I'm like, okay, 1, 2, and I exhale as I lift. And those habits will really make a difference over time.
Those are really great suggestions. Um, I want to talk also a little bit more about just birth and postpartum. I mean, such a big piece of women's lives. We've touched upon it a little bit. But again, like, what about when women are thinking about conceiving or they are pregnant? Again, are these the same? Would you give the same recommendations, or are there more that you would recommend?
So when you're trying to conceive, I'm a big fan of working on pelvic floor strengthening. If you don't have any pain issues, if you have painful sex, the focus is much more on relaxation. So I've worked with women who have had to use a turkey baster to inseminate themselves because they can't have sexual activity. And so that's when you want to work on relaxation and not strengthening. If you are in great shape and there's no problems with pain, then just work on proactive strengthening. Again, working with your transverse abdominal muscles, those deep core muscles, learning how to activate your pelvic floor and relax your pelvic floor. Because once you get pregnant, that all changes. So if you've got that down going into pregnancy, you're in great shape. During pregnancy, and this is what I kind of teach in my online program, is that you want to work on strengthening the deep core muscles. That's going to help minimize that abdominal separation. That's going to give your pelvic floor more support in the first and second trimesters. But in the third trimester, I focus much more on relaxation. So that's doing more yoga type stretching, learning how to breathe and kind of push your muscles out for giving birth. Or if you're having a C-section, kind of working on opening up your abdominal wall and your pelvis so that you have good mobility after giving birth. But really working on relaxation for labor, for birth, is the key for third trimester. If you're going in with super tight pelvic floor muscles, they're going to have a hard time relaxing for baby to come down the birth canal. And I always say, your pelvic floor muscles don't push your baby out. So you don't have to have these super strong pelvic floor muscles going into vaginal birth. Your uterus pushes your baby out. We just need those pelvic floor muscles to get out of the way. So if you learn how to push and relax them properly, it's going to make that a much easier process.
Yeah, birth is such an interesting process because it's something that you can't control, right? And you do. I do feel like the more you can relax, like the more my patients go into the process relaxed, the better the birth outcomes are versus having to focus and control. It's like that stress relief, just overall stress relief, not even during a contraction. I'm just talking about the entire process, so going into that relaxation mindset and practice for the third trimester absolutely helps so much with childbirth.
It is. And it's one of those things that, birth is a very physical experience. And so we're kind of sending moms into that being like, good luck. But if we really learn what it is, learn what our body needs to do, we just feel a little bit more empowered and informed going into that. And whatever course it takes, it's going to take. I mean, there's a lot of things with birth that are unpredictable and that we can't, no matter how much we prepare, it may just go a different way. But the research is very clear. Women who prepare for birth and feel more informed going into that experience, report better birth outcomes regardless of which way they give birth. And I think that's what's important, is having them feel like they are a driver in that experience versus just a passenger and things are happening to them.
Yeah, I mean, maybe we can talk about this. I can tell you have a passion about it. I do too. This is like a cultural misunderstanding that I just wish we could correct, because I do see that all the time. Like, I trained as a midwife in medical school. So I was around like more traditional birth settings where birth had a very positive association. And I also, of course, trained in hospital births, and the experience, being medicalized, like, it's not a bad idea for women to be in a hospital. They should be wherever they feel most comfortable. But it's a medical experience, but only for humans, and I think that it's over medicalized in our country to the point where a lot of women have a lot of apprehension and fear. And then you add to it the cultural conversation of how awful it is and pain, and we have to avoid this. And it's really not serving women. I mean, I'm like you. I had like I had home births with all my children. Such a great experience. Something that I love to talk about because I want more women to know that it's wonderful. It's life-changing. It's really hard, but it's amazing,
Yeah.
And I just think, again, when we talk about pelvic floor therapy, like, the mindset around that experience can really impact the outcome.
Yeah. And it's tricky because I think we see a lot of women in our practice who they're pregnant and they go through, our childbirth preparation, or they do my online program and they're like, I feel like I failed because I had a C-section
Mm,
and I did all this preparation. And I'm like, no, C-sections are a great option for
that's
people when
right.
there's a medical necessity. I mean, it's wonderful that we have that, but it is overutilized. And I think we've given women who've had a C-section, the narrative is unfortunate that it's like they messed up birth or they failed from the beginning. And that's not the case.
That's right.
If you have a C-section, I'm like, I just want you to feel like you were kind of in the decision-making process of that, right? Like you felt like this was the next step that you want to take, that you weren't helpless in that cause. And that is more important to me than which way the baby comes out,
Hmm.
and giving you the rehab and support that you need after. But just like you, I mean, it is being in this field for as long as I have and having mother after mother after mother come in after birth and they are in tears. And again, these are only the women I'm seeing in my practice, so it's not everyone. And they feel like they had a terrible birth experience and they were just, their pelvic floor is shot, their confidence is shot, they don't want to have another baby. I mean, when you hear these stories over and over, you can't just listen to them and think that like, oh, this is just the way it has to be. I'm like, I fundamentally believe there is a better way, and it's not being utilized in medicine. And I don't care how many studies come out saying we need to induce this day and it's like we are just over intervening and it's not serving women because we have terrible postpartum statistics.
We
And
do. I remember when I was looking, like, with my health insurance, I had a group of OBs that were available to me. And out of the ones that were like conveniently located, I started to look up the birth statistics. And one of the hospitals that they worked out of, the majority of them worked out of, had a 46% cesarean rate for their labor and delivery department. And that, like, as a doc, I'm like, okay, there's no way that like 1 in 2 women almost can't give birth. Like, that, this is a hospital problem, a staff problem, something where so many women are moving to cesarean. But I completely agree with you. But it wasn't what I wanted. Some women elect a cesarean, and that's totally fine. And that might have affected practice statistics, as maybe they attracted patients who wanted that, who elected into that. And I'm definitely of the mindset where, thank goodness, we have so many options available that we can choose from, like a menu. I have my preferences. Like, I might order the salmon, you might order the steak. We have different preferences for how to approach it. And all women are amazing because you're growing a human being. And we need to eliminate the judgment around it, because I don't think that serves anyone. However, it is so difficult to listen to women who wanted a certain experience and came out with something different. We're really getting off topic, but I think this is such a great thing to be talking about as women who serve women, because I think a lot of people who are listening probably can relate to that
they
experience.
can. And I think that it's related because it affects how we birth. It affects how we feel about birth. It affects if we want to have more kids. It affects if we can have more kids. And so, and I see that from a very pelvic floor perspective. I just had a patient text me last week about she's got a really severe prolapse after her second birth. And she's like, we're trying to decide if we're going to have another kid. Like, can my pelvic floor handle it? And so I'm thinking these things do really affect our life. And so we just want to give people the resources and the options. I think what's important with birth is options, and then so that they can make the informed decisions for themselves.
The last topic I want to cover around birth is around diastasis recti, or this separation of the abdominal muscles, because a lot of women complain, I'm sure you hear about this more than I do, that like after you have a baby, you have this mom pooch that you just can't get rid of. And that is a chief concern that leads women in to seek care, from what I have experienced myself, because it's like something everybody notices. It's different than it was before. Can you talk a little bit about DR and explain what it is, and like when does it need some kind of support?
So DR or DRA, also called diastasis recti abdominis, is a separation of the midline of your abdominal muscles. So what happens is that during pregnancy, your belly expands, which of course we need it to. And there is a line of tissue in the middle of your six-pack ab muscles called the linea alba, and that gets really stretched out, which of course we need it to. But during pregnancy, when that gets so stretched out that you can't maintain like the tension across it. So if you kind of do a little crunch up and you see like a little football or kind of cone coming out in the middle of your belly when you're getting out of bed or getting out of a chair, that just tells you that there's an area of weakness there. It often persists postpartum. A lot of it has to do with our tissue doesn't just spring back together, that if you're breastfeeding or lactating, your tissues kind of stay a little bit lax for longer. But also you re-stiffen that tissue by doing pelvic floor and core exercises like transverse abdominal contractions. But because we're not rehabbing women to do that, that diastasis can persist. And it feels like you can push your fingers towards your guts, or you continue to have that little dome or cone, or your abs are just kind of distended. It looks like you're still pregnant. So pelvic floor therapy focuses on kind of rehabbing and re-strengthening those muscles, and also teaching you ways to actually prevent it from happening as severely during pregnancy. So teaching women how to get out of bed properly without doing a crunch, how to modify their exercise, how to not strain with bowel movements, all of these things that can help minimize the risk of it and then also help it recover after birth. But I will be honest with you, there are some people who it just doesn't get to where it needs to be. I mean, and it's a problem for them. It's not just a cosmetic problem. It can lead to back pain. It can lead to constipation. It can lead to abdominal distress and pain. So if people want to have surgery to repair it, I always tell them they need to do pelvic floor and core strengthening beforehand. You have to wait until at least a year after giving birth and that you're done breastfeeding. You don't want to have any more kids. You're not going to have any more pregnancies. And you have to do pelvic floor and core strengthening afterwards, because something led to that. And we want to make sure that whatever procedure you have done helps, stay the course and doesn't get problematic again. So, but it really is it's like prolapse. It's like you can help, improve it, but we're just not giving women the education they need. And I will mention abdominal binders. I am a big fan of compression, but I'm not a fan of these like tight waist trainers that are so tight to kind of shrink your waist, because it just puts pressure down instead of in on your waist. And they're just not helpful in the long term. So like a nice pair of Spanx or compression underwear are great after birth, but not waist trainers that can actually make symptoms worse.
I bet that feels so good. Like when all those stitches relax, to have it a little bit kind of
hugged in.
Too.
It's like a hug for your tummy, right?
Exactly. We need hugs after that. It's a lot of work. Can you talk me through, like, if someone is going to do a pelvic floor program or see a PT, like I know there's oftentimes like 6-week or 12-week long curricula or program. For people who maybe think they want to pursue this, but they're just kind of curious about what it entails. I know that people ask a lot of questions about like vaginal insertion and like work from within the vagina versus work that's, external or no one's touching you. Can you just talk us through and help women or listeners better understand what this involves, so that they can be really well aware when they go in?
Absolutely. So, there are so many online programs right now, including my own. I have my book coming out. And I really think what you said earlier is so key, that there's a menu of options, because not everyone can access an in-person PT. Not everyone has the resources, the time, the geographical location to want to be able to do that. So we want to give women options. if you do decide to go in to see a pelvic floor therapist, typically it's one-on-one in a private room. So you're not going to be in a big gym treatment room. And we'll ask you a bunch of questions about peeing and pooping and childbirth and exercise and menstruation, and just to get a big picture of your entire pelvic health. We do external examination of your hips and your abdominal wall to see if there's any imbalances or tension or weakness in the areas. And then we do an internal vaginal or anal assessment. And that's always optional. It's obviously with consent, but it is the way that we assess the pelvic floor muscles is internally. So it's not like a gynecologist where you have stirrups. You're kind of lying on a bed-like surface with a sheet draped over you, undressed from the waist down, and then the therapist will ask you to do a couple movements, like what you'd consider a Kegel contraction or a tightening of the pelvic floor, what you would do to kind of push out like you're pooping or giving birth. And then they'll press on the outside muscles with their finger, and then they'll insert a gloved finger into the vagina and ask you to squeeze around their finger. They'll press on the side walls of the muscles to see if there's tension or tightness. And then they'll ask you to push out like you're having a bowel movement. And that just helps us see how your pelvic floor muscles are doing. And that lets us know if you need strengthening, if you need relaxation work, different things like that to help guide your care.
That's great. And then what about the kind of the PT sessions after assessment?
So a lot of those are it depends on what you need help for. If it's a lot of relaxation that you need, say you have painful sex or pelvic floor tension, it's much more manual, which means like we might do massage internally to the vaginal muscles, outside to the hips and the abdomen. If you've got a C-section scar, we'll work on that. If you have tense glute muscles, we'll work on that. And then we'll give you stretches and postural changes and teach you how to pee and poop and all those things to relax your muscles. Typically, sessions are 45 minutes to an hour. They're one-on-one, again, in a treatment room. And then we give you these things to work on at home to kind of maintain your progress. So our goal is to give you the tools so that you can kind of help yourself. We also train you with something called vaginal dilators or wands to kind of help internally relax your pelvic floor muscles at home. If it's strengthening you need, it's much more exercise-based. So it will be kind of learning how to do pelvic floor and deep transverse abdominal contractions, but building that into like a squat or a lunge or a bridge. And, helping you work towards the goals that you need, like if it's running or lifting your kids or jumping. So it all varies. And a lot of these programs, online programs, and, the one I have it in my book as well, it teaches you just the exercises and the stuff that you can do at home. But, seeing a in-person therapist, nothing beats it. But again, there are plenty of options for you depending on kind of what your situation is.
Yeah, I'm glad you mentioned that. I'm so glad there's online programs. And when I went through my program with my PT, I was actually shocked. I was like sweating during the sessions. Like, it's not easy. It's hard work.
It is hard work. And it's also kind of emotional work sometimes too. Like if you've, had a traumatic birth or you've dealt with painful sex, you have prolapse, you're really kind of in a very vulnerable position where you're getting help. And I think sometimes it can feel like, oh my gosh, this is exhausting physically and emotionally, but I have never had a patient who said, I wish I didn't do this. Every single patient is, I wish I did this and I wish I did it sooner.
I'm sure. And I wish more women knew about it so that they could do it sooner as well. It's really amazing. Part of it, I think, comes down to just more awareness. I think that's, if I could say one thing that I took away from my own personal experience, it's just having an awareness of my core and of my pelvic floor and just having more intentionality, holding it properly when you're going about your daily business is like, picking up your kids, moving around, getting up off the bed, like you said, all of those things.
Totally. And it's, I think, in our generation, we grew up with this narrative, like do your Kegels for better sex or better orgasms or pull in your core for, a slimmer waist. And I'm like, this is all focused on one thing. And it's like tightening, tightening, tightening. But so many people need relaxation or they need a balance. Like we don't strengthen our bicep by bending our elbow and walking around with a weight all day. So you can't just do that for your pelvic floor. You really need to learn, as you mentioned, how to contract it and relax it and be aware of it. And I think it just, once you're aware of it, it's just part of your life. It's like brushing and flossing your teeth. It's just kind of a lifestyle that can really serve you in the long run.
Well, this has been awesome. I'm so glad that you joined us today. I learned a lot. I think our listeners probably learned a lot. If people want to find out more about you, you guys can check the links in our website, and we'll make sure that we, I'll also help with your book launch. Definitely can't wait for that to come out. That'll be great. We'd love to let people know how they can get their hands on that as well. Thank you so much for joining, Sara.
Thanks so much. And, the book is available for pre-order now. It's out on June 10th. I'm super excited about this and just super happy to chat with your community about the pelvic floor. So thanks for having me.
Yeah, it's been wonderful. Listeners, make sure you check in if you loved this podcast with Dr. Sara. We hope you subscribe to our podcast, and we launch one every Tuesday. So I want to make sure you tune in every Tuesday to learn more about hormones, health, women's health, men's health, all the wonderful things we care about at Dutch. Thank you guys so much. See you next week. If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.